Hi, I'm Grace Oding. I'm from Newburgh, Indiana, and I'm a second year pre professional student. I chose to study pharmacy at Purdue University because Purdue has excellent professors and curriculum and rotations. Purdue is also top 10 in the nation for pharmacy, and I really liked the London and Kenya rotations.
My name is Matt Hornfeck. I'm a second year pharmacy student, PharmD student. So it's my second year in the College of Pharmacy, fourth year at Purdue overall, and yeah, I'm exploring a degree in the doctor pharmacy. So yeah, my hometown, I'm from Mars, Pennsylvania, which is a small town about 30 minutes north of Pittsburgh, and it's about a 7-hour drive from Purdue. So in high school, I really enjoyed mostly my science classes, chem, bio, anatomy. So I knew I wanted to do something like that, in college and with my career. Um, Healthcare was a pretty obvious choice, I guess, to do that in. Pharmacy specifically, I guess I chose versus like a doctor because it had less schooling, and yeah, I think that was the primary reason that high school me decided to go the pharmacy route. It was something that was suggested to me pretty early on in my junior year by my parents, and I just kind of rolled with it. But yeah, I would say Purdue specifically, Purdue Pharmacy specifically. So my mom is actually an IU grad, and so while I was visiting her alma mater, we made a trip out to Purdue as well, and I just fell in love with the campus. Just one of those places that I visited, and it was like I could really just see myself fitting in here. Just felt really homey. Yeah, just had that big college feel that I wanted going into college. I think everybody comes in, started out in the Bachelor of Science program for pharmaceutical sciences, and then at the 2-year mark, you kind of make the decision of whether or not you want to split off into PharmD or Doctor Pharmacy, or continue in that Bachelor of Science program. So I knew from the beginning that I was going to split into that pre-pharmacy or the Doctor Pharmacy program after 2 years, and so I started preparing myself pretty much right away. And it was just a lot of pieces that go into it. Mainly they're looking for a well-rounded student, and so you do got to focus on your grades for sure. But um, you know, look at other things like career exploration, so job shadowing. What have you done in that to see like whether or not you actually like pharmacy? Volunteer work, extracurricular activities, leadership experience. All those things kind of go into the application. So you'll spend your first 2 years on campus kind of building that sort of resume, and then after that is the interview process, and so from there that's just kind of the College of Pharmacy and the admissions team wanting to get to know you more as a person to see if you'd be a good fit for the program, because they see you on paper but they want to make sure that you're actually able to just communicate effectively, and they just want to know you, know like what you like and what you're interested in, and just making sure that you'd be just a good fit for the program, a nice well-rounded person. So yeah, it is a lot, but there is a lot of help along the way. Academic advisors at Purdue, starting out in pre-pharm, you'll have an academic advisor that's in the College of Pharmacy, which is really helpful. They know exactly what is required to get into the pharmacy program here at Purdue. So they're a really good guide and a really great resource to help you with any questions you have and kind of relieve any fears, or help you out with whatever you need. So that is something that was really helpful. And then come around interview time and things like that, there'll be a lot of organizations in the College of Pharmacy that will host like mock interviews and things like that, just to help you prepare, to figure out what kind of questions they're going to ask, what exactly your interviewers are going to be looking for, things like that. So it is a stressful process for sure, but it's you're kind of all in it together, and it's there's a lot of help and a lot of support throughout it. So yeah. So once you complete your 2 years of pre-pharmacy, you'll start pharmacy school, which I found the courses there are a lot different. Definitely more challenging, but more enjoyable, I'd say, just because the material is a lot more applicable. So we have our big therapeutics class, which in that class we have every semester. So we'll learn about a disease, how that disease affects the body, and then we'll learn about medications that are used to treat that disease and how those medications work, in the body on that disease. And then from there we'll learn about how to use those medications in practice. And so it's just really, really practical stuff. And then other classes that I really enjoyed in the professional program, just kind of, going over, the healthcare system in the U.S. and how that works, and insurance and things like that, and public health, population health issues, and what it means to be a part of a healthcare team working with doctors and nurses and things like that. So yeah, overall I would just say really applicable course material that we learn once you're in pharmacy school, and you'll pull a lot of the basic info you learned in pre-pharmacy and a lot of your upper level high school courses, and more apply that to pharmacy specifically. So yeah, Purdue is a really big school, especially coming from high school. It can be daunting to get on a campus with 30,000 people, 7,000 people in your freshman class. Especially for me, like my high school graduated with 240 kids in my class, so it was a big jump. And coming from out of state, I didn't know anybody, so just kind of a little overwhelmed at first. Like, how do I meet people? So I think one of the main things I did freshman year was I was in the living learning community for pharmacy. So everyone on my floor freshman year was in pharmacy school, or pre-pharmacy. So that was really cool. We kind of had our community there already set up. But other than that, just getting involved on campus was the main thing. Fraternity life here, or sorority, cooperative life. It's really big here at Purdue, and so I was able to get involved with that, meet a lot of people through that. Did Boiler Gold Rush, which was the orientation program, so I did that as an incoming freshman, and then I got involved in that as a student my freshman and sophomore years as well, helping out with that, which gave me another really great community of friends. And then just other things like ministry was a really cool opportunity for me to get to meet a lot of like-minded people and give me another source of community. And so yeah, you'll find that just getting involved, I think a lot of the ways you'll meet a ton of people, and then they'll know people that and so it just starts to make campus feel a lot smaller and more of like a family, like a tight-knit community. And the College of Pharmacy itself, once you're in the pharmacy program, you're only going to have 150 kids in your class, and so you'll have class every single day with those people, and like labs and pharmacy organizations and things like that. And so you'll get to know the people in the College of Pharmacy pretty well, and the professors will make a really good effort to get to know. They want to get to know you got students as well. So definitely does feel a lot smaller the more you're involved at Purdue, and then especially once you're in the professional program here, you have that source of community as well.
I have gotten involved in a lot of clubs, and I'm an outgoing person, and I've met many friends, which makes a big school feel more personalized.
I'm not really sure exactly what I want to do yet. So we have these things called rotations that I'll be participating in my 4th year of pharmacy school, which I'll get to try out some different work locations within the field of pharmacy, so I can get a better feel of exactly what I want to do. I know I definitely want kind of a patient care component, And I think what is really cool about pharmacy is that I'm still, my fourth year of school, and I still don't know what I want to do, and that's perfectly okay. There are a lot of options, and it's not something that you necessarily have to figure out while you're still in school, because I think Purdue does a really good job of training you to be versatile and flexible, and equip you with the tools you need to have to be able to pursue those multiple options in pharmacy, whether that be industry, clinical pharmacy in a hospital, or just working in the community setting, or even things unrelated to pharmacy. Just using the skills and the ways that we are taught to learn things and look at things can be used in other fields as well. So that's what is really exciting about the field of pharmacy. It can be a little stressful sometimes because a lot of options, but I think it ultimately will be a very positive thing.
I have an internship at a hospital pharmacy, and I've helped open a new hospital pharmacy, and I work with doctors and nurses and narcotics and patient medication. I have seen a lot of hospital pharmacy, but I am also interested in industrial pharmacy. Start shadowing and start looking for opportunities in pharmacy to see if you have passion and would enjoy a career in pharmacy. I would say learning self discipline and learning how to balance school, a social life, and being healthy.
So I would say for me, piece of advice would be to just always ask yourself why you're doing something. It's really easy to get caught up in the application process, or just like building a resume and trying to make yourself this well-rounded student, and doing things for that reason. But I think it's really important to take a step back and just look at, like, am I actually enjoying these things? Are these things, being fulfilling to me? Are they things I actually like to do, or am I just doing them to try to make myself look better? And so, yeah, just constantly asking yourself, like why am I doing these things? I think, for me, even has helped a lot with my motivation. And when I start to really explore the reasons why I'm doing things, and I discover it's because I'm actually passionate about something, or enjoy something, I'm more likely to put in the time for it.